Hi. Thanks for letting us all come. I'm actually here on behalf of Developmental Pathways. We are a community-centered board, serves Arapahoe, Douglas County, and the city of Aurora. And so we are today talking about folks who have intellectual disabilities as well as a secondary diagnosis of a behavioral health need. So we've talked with a lot of families. We deal with a lot of individuals, adults, kids, families, foster care, everything you can think of, but it all has to relate to intellectual disabilities. And we've had a lot of families who are struggling because they're working with somebody who has the dual diagnosis, and the biggest thing is that when you've got a dual diagnosis, everybody says, nope, you gotta go over there, and you gotta go over there. So the fractured system is our biggest concern because families don't know where to go and they're frustrated on that. They've talked about how much time they spend and they feel like their time is their money, and they're trying to find a provider, and they find someone who can actually provide them service. They get in there and the person struggles, knows how to serve a behavioral health or a mental health need, and doesn't know what to do with somebody with an intellectual disability. So our first request is, when you're looking at this system, is to figure out how can we do some incentives or training to get more providers who are able to do dual diagnosis services. And then with it, looking at the wait lists. So we have a lot of families who are just like, I'm great, I've got somebody on a wait list. But again, you've probably heard this also, even without the intellectual disability, it's with the wait list, what do you do in the meantime? And so we've got families who are there and they're struggling when their situations have to progress to an emergency status before they can get services and supports. Or they hit the emergency status, and as soon as they're off the emergency status, they're no longer the priority, and so they get kicked out of a service. So that's one of the biggest issues as well, is not having a priority service for something when families are trying to get their needs met before it is a crisis, before an emergency happens. And so we have set up a crisis system in our agency and a crisis supports, and we go through all of that funding that we have, and we're grateful for our mill levy to cover it, but it's hard, that mill levy is limited, and so it doesn't meet all the needs. So first thing that we wanted to say is provider capacity is very limited for our families. We'd like to have, again, recommend some training or incentives so that we can get folks who are professionals who also have the intellectual disability background. We also would like to talk about some access to supported services. One thing is we have siblings and parents, caregivers who have mental health needs or behavioral health needs because of the person that they're caring for with an intellectual disability. So even if services are covered by Medicaid, if somebody's on a waiver, oftentimes their siblings start having troubles. We've got lots of siblings who have depression from it, and they can't get services because they're not on a waiver, and their insurance doesn't cover it, or all of those things. So we'd like to recommend also that that families can get services, that somehow we can create a system where families who have somebody with a disability can get services off of their Medicaid or off of somehow, so that the families aren't struggling anymore with that. Trying to pit, which child do I care for first? Or how do I care for my brother when I'm struggling on my own too? So looking at that, how do we get a system where we can serve the caregivers as well? And again, getting those incentives so we can create and develop intellectual disability and mental health provider base and medical professionals who can do all of those things as well. Our families are looking for more diversity in therapists, more locations, which is probably a very common thing as well. They're calling around. We've had one mom who called 40 psychologists and left 40 messages. We're not allowed to give recommendations on who to call, so we can give them a list. And she called 40, talked to one, got a message from one, and neither of them served kids. So she's still at stage one of, where do I go? I've got the Medicaid to cover it, but I don't know who will take care of my child. And so that's one of our access to applicable services. She has the way to pay for it, but doesn't have access to anything. So we'd like a system that's going to help share with families who is eligible to cover you. We'd also like to see, that goes along with the affordability as well. We've got families who are paying out of pocket for services because they can't find something covered by their Medicaid waiver. And so they're looking at, let's just pay for this out of pocket because it's not considered a crisis, but it's a crisis to us. And so they're looking at affordability issues. How do we cover that? I'm not sure how the state does that, but we would like to recommend looking at some system that helps get these services to families. If they can't find a Medicaid provider, how do we pay for that then when they need somebody to take care of them? For residential, we've got not enough beds for residential services. Also, it's very difficult when you've got an intellectual disability. Where's the right place for you? And so we need some more systems or no more beds for that. So looking at a state system for residential treatment of people with IDD and mental health is almost non-existent. And so we need the regional center to be expanded, and treatment should include children. And we are struggling with continuity of services. So families who are on private insurance and then they go on to a waiver and they have to switch all of their providers because now they're on a Medicaid waiver. And this is a real struggle when you've taken years to find the right provider and then you go to Medicaid and you can't have that provider anymore. So we need a better continuity of services from insurance to Medicaid for folks who are going to be getting services for their lifetime. And looking at that, how do we get that? So we've got the suggestion of payment streams that are simplified, public and private streams simplified, providing training or support so that we can have more providers who are interested in serving. I'll serve all of these insurances and Medicaid, whichever it is, so I can provide my services to the folks who are coming to me. So that's one of our suggestions there, to help with continuity of services and affordability and cover the insurance and the Medicaid piece. We're also looking at suggesting a fully funded public guardianship system so that we've got adults who need support. They've got someone who can help them through. We believe that will help their continuity of services when they've got somebody who is able to take care of them when they don't have a designated family member who can do it. If we've got the public guardianship, then we can have somebody helping them through the system and helping them before they drop off and out of the system. So we don't want them dropping off anymore and getting into the crisis stage before they get supports. And I know that's already in the works, but we're pushing, please, let's get that all the way in. And then last one, for the emergency psychiatric services, we've got families who, again, they're struggling because they're not at the crisis point, but they know that that's where they're headed if they don't get the services. And you know that the services are limited until you hit the crisis point. And so we're looking at how can we expand services that way. We've got families who've been turned away from hospitals because they're told, oh, this is an IDD issue, not a mental health issue. And again, they're fighting back and forth. This is both, or it's one or the other. Somebody just come. And so they're at a loss for what to do. How do we get that system corrected so that we can have, it doesn't matter whether it's the mental health or the IDD, we've got somebody here who's going to take a look at you and figure out what needs to be covered. We don't want people turned away anymore from the short-term or long-term placements, but specifically for emergency psychiatric services, we need capacity expanded at the Pueblo Mental Health Institute for violent non-compliant offenders who cannot safely be in the community, whether it's mental health only or intellectual disability and mental health. That's a real struggle of enough placements for them so that we can keep them safe as well as the community safe. I believe those are our points. We asked a lot of families their input, and so I've got little stories and quotes. I'm sure you guys have heard all of those different pieces as well. But again, I just want to reiterate our main recommendations are incentives to create and develop intellectual disability mental health provider base, including medical professionals. State system for residential treatment of people, adult and children with intellectual disability and mental health. That a regional center should be expanded and treatment should include children. That we need a fully funded public guardianship system implemented statewide. We would like to see payment streams, public and private, simplified, and that training is provided so that other people can join into a different stream if they're only in one at the time. And that we see capacity should be expanded at the Pueblo Mental Health Institute for violent non-competent offenders who cannot be integrated into the community. So thank you so very much. Thank you.